Welcome to the deep dive. Today, we're tackling something pretty intense. That moment you realize you might be having a heart attack, an acute myocardial infarction, and you're completely alone. It's, well, terrifying to even think about. So our mission today isn't just listing symptoms. We want to give you a fast, actionable survival guide. What cardiologists actually recommend, the steps to take when every single second counts. This is really about survival.
It absolutely is. And we have to start with a stark fact. About half, 50% of heart attack deaths happen within that first hour.
Wow, 50%.
Yeah. So if you're alone, knowing what to do, acting fast based on that knowledge, that's often the difference. It cuts through the panic. It's life or death, really.
Okay, let's dive in. Recognition first. Most people think heart attack equals chest pain, right? That classic element sitting on your chest feeling, intense, tight, crushing.
Right. That is the classic sign, definitely. That crushing pain. And how it often radiates, maybe down the left arm, sometimes the right, or up into the jaw, even the back. That's textbook.
But it's not always like that.
Exactly. And focusing only on that chest pain means people miss other crucial signs. There are about 6 others we really need to talk about. And these are particularly important because they might be the only signs for some people, especially women or those with diabetes.
Okay, so what's number 1 after chest pain?
Intense sweating and paleness. And we're not talking about just feeling a bit warm. This is a cold, clammy, drenching sweat. It's your body's adrenaline response kicking in, constricting blood vessels. It's a major physiological distress signal.
Okay, cold sweat. Got it. What about that feeling? Sometimes people describe it like indigestion, like it's coming from the stomach.
Yes, that's the second one. Nausea, sometimes vomiting, or just this vague gastric discomfort. It happens because the lack of oxygen to the heart, that's cardioischemia, can irritate the vagus nerve.
Ah, the vagus nerve connection.
Precisely. And here's the really crucial part. This nausea or stomach issue is incredibly common in women having heart attacks. They often think, oh, it's just a stomach bug or food poisoning.
And they delay getting help.
Exactly. Dangerously delay. And it's even more complex for diabetics. Because of potential nerve damage, neuropathy, they might only get nausea or that weird stomach feeling, no chest pain at all.
So if you're diabetic, unexplained sudden nausea, you have to take that seriously.
Very seriously.
Yeah.
Treat it as a potential cardiac event until proven otherwise. Don't brush it off.
Okay, what's next on the list?
Number 3 is dizziness or feeling faint. Could be a drop in blood pressure, maybe an arrhythmia starting. Again, this one seems to be more predominant in women.
And number 4?
Numbness or a strange heaviness. Often the arm, could be left, could be right, sometimes just the hands, or even, oddly, both elbows. It's like the brain is getting crossed signals from the heart's distressed nerves.
So the signal's right, but the brain puts it in the wrong mailbox, basically.
That's a good way to put it, yeah.
Sure.
5th is shortness of breath, feeling like you just can't get enough air, like you're suffocating. And this can happen with or without any chest pain. It's often because the heart isn't pumping efficiently, so fluid can start to back up into the lungs.
Right, makes sense. And the last one?
Number 6, this intense feeling of anxiety or impending doom. It's more than just worry. It's like a sudden, overwhelming panic attack driven by that adrenaline surge. Your body is screaming that something is profoundly wrong.
Okay, so you recognize one or more of these signs. You're alone. Panic starts setting in. What is the absolute number 1 first thing you have to do?
Call for help immediately. Dial 911 or your local emergency number. Don't hesitate. Don't second guess. Call a neighbor, a family member, whatever. Get someone alerted fast. Because time's muscle. Heart muscle.
Right, time is muscle.
The quicker you get to specialized care, the less permanent damage to your heart. Now, if you call for an ambulance, EMS, and they tell you, it might be over 15 minutes.
Which can happen, definitely.
It can. In that case, you can't wait. You need to get moving. Call a taxi, call an Uber or Lyft. Get someone to take you to the nearest hospital emergency room right away.
Okay, this brings up a really common thought, I bet. People think, okay, time is critical. I feel awful, but maybe I can just drive myself. It'll be faster.
No. Absolutely, unequivocally no. Never drive yourself.
Why not? What are the risks?
2 huge risks. First, you could suddenly lose consciousness or have a major arrhythmia while you're driving.
Oh.
You crash, you hurt or kill yourself, maybe others. It's catastrophic.
Okay, that's a big one.
And second, even if you feel okay-ish mentally, the physical act of driving the steering, braking, the stress of traffic, it puts more strain on your heart. It worsens the ischemia, that oxygen starvation. You need to conserve every shred of energy. Driving is exertion.
Don't drive. Got it. So you've called for help. Help is on the way, whether it's EMS or a ride. What do you do while you wait? Any prep work?
Yes, make it easy for help to get to you. Unlock your front door. If you have pets, try to get them into a separate room. Maybe shut the door so they don't interfere or get scared.
Good point.
And crucially, have your information ready. A list of medications you take, any known allergies. Keep it on your phone, maybe in your wallet, somewhere obvious. First responders need that info fast.
Okay, doors unlocked, pets secured, info ready. Now you're just waiting. What's the best way to wait? Physically, mentally.
The goals are simple. Stay calm and conserve energy. Easier said than done, I know, when you're scared. But panic genuinely increases the heart's workload. Try slow, controlled breaths if you can.
And body position. Does that matter?
Yes. Sit down or lie down, whichever is more comfortable. Ideally, sit with your back supported and your head slightly raised. This can ease pressure on the heart a bit, and importantly, it reduces the risk of injury if you do suddenly feel faint or lose consciousness.
Right, prevents a heart fall.
Exactly. And absolutely no physical exertion. Don't get up and walk around. Don't think, oh, I should just quickly tidy up. No. Every movement uses oxygen your heart desperately needs. Stay put.
Okay, this is crucial. Now, what about medication? People often reach for something. Is there anything specific you should take?
Yes, aspirin. If you don't have a known allergy or a reason your doctor told you specifically not to take it, like a bleeding disorder, take aspirin.
Okay, aspirin. Swallow it with water.
No. And this is the key detail, the aha moment maybe. You need to chew it. Chew 2 or 3 standard low-dose tablets, usually 81 or 100 milligrams each. Don't just swallow them.
Chew them. Really? Why chew?
Speed. Chewing gets the aspirin into your bloodstream much, much faster, absorbed directly through the lining of your mouth. Swallowing means it has to go through your stomach first, which takes longer.
And what's the aspirin actually doing in that moment?
It's an antiplatelet. It helps stop blood platelets from sticking together and making the clot in your coronary artery bigger or more solid. It doesn't dissolve the clot, but it can help prevent it from getting worse, buying you precious time until doctors can properly intervene.
Wow. Okay, chew the aspirin. That's a huge takeaway.
Right.
Now let's tackle some myths. You hear things online. What about this cough CPR? Does that actually work?
No, absolutely not. Cough CPR is, frankly, dangerous misinformation.
Yeah.
It has zero medical basis for a heart attack. Remember, a heart attack is a blockage. Your heart is still beating. That's why you're conscious.
Yep.
Coughing cannot possibly dislodge a physical clot stuck in your artery. CPR, the real kind with chest compressions, is only for when the heart has actually stopped beating cardiac arrest. If you're conscious enough to cough, you're not in cardiac arrest.
So ignore the cough CPR stuff completely. What about other medications? Maybe someone has erectile dysfunction medication like Viagra or Cialis lying around. Those are vasodilators, right? But wouldn't opening up blood vessels help?
You must avoid taking those. Vasodilators like sildenafil or tadalafil do not help in a heart attack. In fact, they can be incredibly dangerous.
Dangerous. How?
Specifically, if the heart attack is affecting the right ventricle of your heart, taking a vasodilator like that can cause a sudden, massive, and potentially fatal drop in blood pressure.
Oh, wow. Okay.
Stick to the plan, call help, stay calm, chew aspirin. Don't experiment with other drugs. It's not worth the risk.
Okay, let's shift perspective slightly. What if you are the helper? You get called over or you find someone and they're unconscious, no breathing, no movement. What's the protocol then?
Right. If they're unconscious and appear lifeless, you have to assume it's a massive heart attack that's led to sudden cardiac arrest. First, call 911, immediately tell them the person is unconscious, not breathing. They bring the critical equipment, like a defibrillator.
And while waiting for them,
You start CPR immediately. Hard and fast chest compressions in the center of the chest. Aim for a rate of 100 to 120 compressions per minute. Don't worry about rescue breaths if you're not trained or comfortable. Just keep doing compressions. Push hard, push fast, and don't stop until the professionals take over.
okay, push hard, push fast. Now back to the person experiencing the attack. They make it to the hospital. You mentioned time is muscle. You can't just sit in the waiting room, can you?
Absolutely not. You need to advocate for yourself or have whoever's with you advocate. When you check in, state clearly, I think I'm having a heart attack. Use those words. If you feel like you're being dismissed or told to wait, you need to speak up firmly.
What should you push for? What are the minimum checks?
The absolute minimum is an electrocardiogram, an EKG or ECG right away, and blood tests to check for cardiac enzymes, which indicate heart muscle damage. These need to happen quickly.
And if it is confirmed, what happens then?
Modern medicine is, thankfully, very effective here. Treatment might involve thrombolysis, which is giving powerful clot-busting medication through an IV to dissolve the blockage, or more commonly now, especially at specialized centers, is cardiac catheterization. They thread a thin tube up to your heart, find the blockage, and often perform angioplasty, inflating a tiny balloon to open the artery, usually followed by placing a stent, a tiny mesh tube, to keep it open.
And these treatments work well.
They do. The speed and effectiveness of these interventions are why, as we mentioned, heart attack mortality rates have dropped significantly, about 21% on average over the last couple of decades. Getting that artery open quickly is key.
That's genuinely good news, but obviously prevention is better than needing treatment. Can we quickly touch on the main risk factors people should be aware of?
Sure, some things you can't change, like age risk increases for men over 45 and women over 55. Family history plays a role too. But many key factors are modifiable.
Like what?
Smoking is a huge one. High blood pressure, high cholesterol, diabetes, these need to be managed. Obesity, leading a sedentary lifestyle, chronic high stress, even use of illicit drugs like cocaine can trigger heart attacks.
So the prevention strategy is basically healthy living. Sounds simple, but it's hard.
It is simple in concept, requires discipline and practice. A balanced diet really focusing on limiting saturated and trans fats, cutting down on added sugars and processed foods. Regular exercise is vital. The recommendation is typically around 150 minutes of moderate activity, like brisk walking, or 75 minutes of vigorous activity, like jogging, each week.
And managing those underlying conditions.
Absolutely critical. If you have high blood pressure, diabetes, or high cholesterol, work with your doctor to get them under control with lifestyle changes and medication if needed. Leaving them untreated is like, well, letting ticking time bombs just sit there.
This has been incredibly informative. Let's just crystallize those main takeaways for everyone listening. First, know the signs, especially the ones beyond chest pain, that intense nausea, the cold sweat, dizziness. They're major warnings.
Right.
Yeah.
Second, call for help immediately. 911. Get a ride if EMS is delayed. And never drive yourself.
And third, that really specific, actionable tip. If you can take aspirin, chew 2 or 3 low-dose tablets. Don't swallow them whole. Chew for speed.
Exactly. Knowing these steps, internalizing them, can turn sheer panic into a focused response.
Yeah.
Remember, the time from that first symptom to getting that blocked artery opened, that directly impacts your survival and your quality of life afterward. It reduces complications like heart failure down the road.
Yeah.
Knowledge empowers action.
So we'll leave you with this thought to chew on, perhaps. Knowing that this time window is everything, what concrete steps could you take, maybe even today, to shorten that window if this ever happened to you or someone you love? Is that medication and allergy list actually on your phone right now? Do you know where the closest hospital with emergency cardiac care is? Think about it now before you ever need it.
Preparation can make all the difference when the unthinkable happens. Be prepared.